Right. Got to talk about something that's been kind of hard to miss lately, diabetes.
Yeah.
It's everywhere, right? In the news, impacting people we know.
Like,
Just yeah, it's a big deal. So whether you're someone prepping for like a meeting or trying to keep up with healthcare or just curious this deep dives for you, we're looking at a recent WHO fact sheet, just a ton of stats and insights.
mm.
Some of them honestly kind of blew me away.
Oh, yeah.
Like, did you know the number of diabetes cases has just exploded in recent decades?
Yeah, that's really,
And over half the people living with it aren't
right.
even on meds.
It's wild, isn't it?
Yeah, it's a bit of a health mystery we're going to try and unpack.
Yeah, it's fascinating. We have more knowledge about diabetes than ever,
Right.
yet the numbers just keep climbing.
Mm,
It's not just individual health either.
right.
This has huge implications for healthcare systems and economies worldwide.
Yeah, that's what I was thinking too. It's like, okay, first, the scale of this is just massive. The WHO report says we went from 200 million adults with diabetes in 1990 to a massive 830 million in 2022.
Wow.
That's more than a fourfold increase. Are we just living longer or what's going on?
Well, it's more complex than just longevity. Sure, older populations play a part.
Yeah.
But what's really driving this surge is a mix of things.
Like what?
Well, the changing lifestyles, especially the rise of, processed foods
Mhm.
and sitting down on the job all day long, those are major contributors.
Makes sense.
And this isn't just a high-income country problem.
Oh, really?
The prevalence is actually rising faster in low and middle-income nations.
That's interesting. I guess those are the areas that are going through like the fastest development and urbanization.
Exactly.
So their lifestyles are probably changing the quickest too.
You got it.
The WHO report kept mentioning diabetes as a silent threat.
Hmm.
Wouldn't people feel something being wrong?
Well, that's the thing. See, the symptoms, especially for type 2 diabetes,
Uh-huh.
they can be really subtle. So people might not even realize they have it until, complications start popping up.
Oh, so it's already
Yeah,
kind
it's
of
too late.
too late. Yeah.
Imagine having high blood sugar for years without a clue.
Oh, wow.
It's like a slow burn. It can damage your blood vessels, your nerves, your organs.
So it's not just managing symptoms then, it's preventing long-term damage we might not even know is coming.
Exactly.
But hold on, before we get too doom and gloom, let's rewind a bit. There are different types of diabetes, right?
Right, right. It's not a one-size-fits-all thing.
Yeah, yeah.
We have type 1, type 2, and gestational diabetes. The simplest way to think of type 1 is that your body just doesn't produce insulin.
Okay.
That's the hormone that regulates blood sugar.
Got it.
So daily insulin shots are, vital for survival. This type is often diagnosed in childhood.
Mm.
And sadly, we don't yet know how to prevent it.
Okay, so that's a situation where your body just can't do what it needs to. What about type 2? That's the one we hear about most, right?
Absolutely. Type 2 is a bit more complex.
Okay.
Your body either doesn't make enough insulin or can't use it effectively,
Mm-hmm.
which leads to those high blood sugar levels we were talking about.
Right.
This is where lifestyle choices really make a difference. Diet, exercise, all that.
Okay. And gestational diabetes, I know that one's tied to pregnancy, but is it like temporary?
You could say that
Yeah.
it develops during pregnancy and usually goes away after delivery.
Okay.
But, and this is important, it does signal a higher risk of developing type 2 diabetes later for both the mother and the child.
Wow. So it's like a
warning sign.
warning sign, yeah. But of all these types, which is the most common? Is it that type 2?
You nailed it.
Hmm.
Over 95% of people with diabetes have type 2.
Wow.
And here's the kicker. It's not just an adult onset condition anymore. We're seeing more and more kids diagnosed with it.
Really? Kids too?
Yeah.
That seems like a huge change from what we used to think about diabetes. What's going on there? Is that because of those lifestyle changes we talked about?
It's definitely a contributing factor. Sadly, kids today are less active and exposed to more processed foods and sugary drinks than earlier generations.
Yeah, that makes sense.
And that, along with genetic predisposition in some cases, is a recipe for type 2 diabetes to show up earlier in life.
So it's like this mix of our biology and the environment.
Right.
This is already making me think about my own habits. But getting back to the silent threat idea, if the symptoms are so subtle, what should people even be watching out for? And is everyone equally at risk?
That's where it gets tricky. It's not always obvious.
Yeah.
Some common signs are things like increased thirst, peeing more often, unexplained weight loss, fatigue, blurry vision,
Okay.
and sores that take forever to heal.
Mm-hmm.
But you can easily mistake those for other things.
Right.
And no, not everyone's equally at risk. Family history, ethnicity, age, and lifestyle choices all play a role.
So it's like a detective game then.
Kind of.
Figuring out if what you're feeling is normal or a sign of something worse. This makes the fact that so many people are undiagnosed even more worrying. The WHO report says that over half of those living with diabetes aren't even on medication.
It's a huge number.
Yeah, that's a lot.
It really highlights how important regular checkups are and blood tests, especially for folks with risk factors. Early detection is key to preventing those long-term complications we were talking about.
All right, so let's get into those complications. This is the part that always makes me a little nervous.
Sure.
What are we talking about here?
Well, we're talking serious stuff. Heart attacks, strokes, kidney failure.
Kidney failure.
Hmm.
That's not something you just bounce back from easily. How often does that happen?
More often than you'd think, diabetes was actually responsible for over 500,000 kidney disease deaths in 2021 alone.
Wow.
And it doesn't end there. Uncontrolled diabetes can lead to vision loss, blindness, nerve damage,
Oh, man.
and in really severe cases, even amputations.
Okay. That is a lot to process.
It is.
It's clear that uncontrolled diabetes can really wreck your health, making me rethink those late night snacks.
Yeah.
But before I swear off sugar forever, let's shift gears a bit. There's got to be some good news, right? Can we even prevent this? Or at least manage it well?
Absolutely. There's good news. While type 1 diabetes isn't currently preventable,
Yeah.
type 2, the most common type, often is. And even for those already diagnosed, effective management can drastically reduce the risk of those scary complications we talked about.
Okay, that's a relief to hear. So what does prevention for type 2 look like? Is it all about those dreaded lifestyle changes everyone's always talking about?
It might sound cliche, but those lifestyle changes really are the most powerful tools we have.
Okay.
And they don't have to be crazy overhauls.
Okay.
We're talking about things like getting to and maintaining a healthy weight,
Right.
getting regular physical activity at least 150 minutes a week,
Wow. Okay.
and making healthier food choices.
So it really is about those daily choices.
Really is.
Let's talk about how diet and exercise can help. What are we talking about specifically? What should people be eating, and what kind of exercise works best?
For your diet, think about shifting toward whole, unprocessed foods, fruits, veggies, lean proteins, and whole grains.
Okay.
It's about pushing out the processed foods, sugary drinks, and saturated fats that are in so many modern diets. And for exercise, find something you actually like.
Okay.
Walking, swimming, dancing, gardening, it all adds up.
I like that.
Aim for at least 30 minutes on most days of the week.
That's good. I was picturing hours at the gym, but it sounds like just getting some movement in our daily routine is what matters.
That's what it's all about.
I actually have a friend who completely turned their health around after being diagnosed with prediabetes.
Oh, wow.
Just by making changes like this. They lost weight, started hiking a lot, and really cleaned up their diet, and their blood sugar levels actually went back to normal.
Fantastic.
Yeah, they managed to avoid full-blown diabetes.
That's amazing. It's a perfect example of how even small changes done consistently can have a massive impact. You don't need a complete life makeover to make a difference.
It's about making lasting changes, not temporary fixes.
Exactly.
So what about folks who are already living with diabetes? What's good management look like for them?
Managing diabetes effectively is a multifaceted thing.
Right.
But it all starts with a good partnership with your healthcare provider. They'll help you create a personalized plan based on your unique needs.
So open communication with your doctor is key.
Absolutely.
What else?
Well, regular blood sugar monitoring is crucial to see how your body's reacting to different foods, activities, and any medications you're taking.
Okay, let's talk about medication. I know insulin is a must for type 1, but what about type 2? Is it all about insulin, or are there other options?
For type 2, it's usually a mix of lifestyle changes and medications.
Okay.
There are various drugs that can help manage blood sugar. Some help your body use insulin more effectively. Others reduce how much glucose your liver makes. Insulin might be needed for some folks, especially if other treatments aren't working well enough, but it's not usually the first option.
Got it. So there's a bunch of tools available, and it seems like finding the right combo by working with your doctor is key.
You got it.
Is there anything else people with diabetes should be doing to stay on top of their health?
It's about being proactive
Right.
and taking a holistic approach.
Okay.
Remember, diabetes can make you more likely to have other health problems.
Right.
So it's important to be on top of those.
Yeah.
So for instance, paying close attention to your feet
Oh, right.
to prevent ulcers,
Yeah.
getting screened for kidney disease,
Yeah.
making sure you get regular eye exams to catch retinopathy early on.
So it's not just managing blood sugar. It's about taking care of your whole self.
It is.
Seems like a lot to handle, but I imagine the benefits outweigh the effort.
Absolutely. by being proactive and inform people with diabetes, can live full and healthy lives. And that's the message we want to get across. It's not about living in fear. It's about empowerment and owning your health.
That's a great point. It's about taking charge, not letting diabetes run the show.
Exactly.
We've covered a lot today, from the global scale of this to the personal impact it can have. But we've also learned about how powerful prevention and early intervention can be and how to manage it effectively.
Couldn't have said it better myself. We still have a lot to unpack, though.
Oh, right.
Like, what exactly is the World Health Organization doing to fight this global diabetes epidemic?
Yeah.
And what resources are out there to help people living with the condition?
You're right. We've only scratched the surface. Let's take a quick pause and come back to explore those aspects in more detail. So before the break, we were starting to talk about the global response to diabetes. You mentioned the WHO's Global Diabetes Compact.
Right.
What's the deal with that? What are they actually doing?
Well, it's a pretty ambitious initiative they launched back in 2021.
Yeah.
And it's really about tackling the problem from all sides. One of the big things they're focused on is raising awareness,
Okay.
especially in low and middle income countries, where access to information and resources might be limited.
So it's about giving people the knowledge they need,
Yeah.
not just throwing medicine at the problem.
Exactly.
Yeah.
The Global Diabetes Compact is about giving people the tools to make smart choices,
Right.
whether it's about preventing type 2 diabetes or managing it well if they've already got it.
Makes sense. But awareness is just one piece of the puzzle, right?
It is.
What about access to actual care and treatment?
That's another huge part.
Yeah.
The Compact is working to improve access to things like affordable insulin, testing supplies, and medications to manage complications,
Right.
all of which can be super expensive,
Yeah.
especially in places with limited resources.
I bet. Yeah, it's got to be tough enough dealing with a complex health issue
It is.
without worrying about whether you can afford the basics.
For sure. And it's not just about individuals either.
Really?
The Compact is also focused on making healthcare systems in these countries stronger.
Okay.
This means training healthcare providers, improving how they diagnose diabetes, and setting up better systems for managing diabetes care overall.
Sounds like a huge task.
It is.
But it's got to be done if we're going to really make a difference with this global epidemic. It's good to know there's a coordinated effort happening on such a big scale.
It is, definitely. And it doesn't stop there.
Oh.
The WHO is also really pushing for research and innovation in how we prevent and treat diabetes.
Research always pushing the boundaries? What's exciting in the research world right now?
Well, there's a ton going on.
Okay.
Scientists are working their tails off to come up with new and better meds, exploring new ways to deliver insulin,
Okay.
and digging deeper into how our genes affect our risk of getting diabetes.
Right.
There's also a lot of focus on understanding what causes type 1 diabetes, with the goal of being able to prevent it entirely someday.
So it's like a multi-pronged attack on all fronts.
That's one way to put it.
That's got to give people hope that we're not just stuck with the problem as it is.
Exactly. And it's important to remember that diabetes isn't just a medical issue.
Right, right.
It has big social and economic impacts, too.
It's a good point. I think we tend to focus on the individual health side of it,
Yeah.
but it's so much bigger than that.
Yeah.
What are some of those broader impacts you're talking about?
Well, for one thing, the cost of treating diabetes and all the problems that come with it puts a massive strain on healthcare systems everywhere.
Yeah, yeah.
It's a long-term condition
Right.
that often needs ongoing medical care, meds, and sometimes even hospital stays.
I can see how those costs would really add up,
They do.
both for people and for the healthcare system as a whole.
It's not just about the direct cost of treatment either. There's also the economic hit from lost productivity,
Okay.
because people can't work as much due to diabetes-related disability or early death.
Wow.
It's like a domino effect,
Yeah.
touching so many parts of society.
So it's a public health problem, an economic problem, and a social problem all in one.
That's it.
Sounds like a challenge that needs a solution that hits from all angles, too. Which hopefully is what the WHO and these other groups are working towards.
Exactly. It's about working together, coming up with new ideas, and having a shared goal of making global health better. But while these big efforts are super important, there's a lot that individuals can do, too, to protect themselves and the people they care about.
Let's switch gears then and talk about what people can do on a personal level. We've touched on lifestyle changes, but let's get into some practical advice.
Okay.
What are some real steps people can take to lower their chances of developing diabetes?
Well, we've already talked about diet and exercise. And even though it might sound obvious, those two things really are the most important.
Okay.
Staying at a healthy weight is crucial.
Right.
And that doesn't mean crazy diets or anything extreme. It's about making changes to your eating habits that you can stick with.
So what kind of changes are we talking about?
Think about moving towards a Mediterranean style of eating.
Okay.
Lots of fruits, veggies, whole grains, lean protein, and healthy fats. And try to cut back on processed foods, sugary drinks, and all the saturated fats hiding in packaged stuff.
Okay, good starting points. What about exercise? What's the magic formula?
The best exercise is something you actually enjoy
Okay.
and that you'll keep doing. It doesn't have to be super intense.
Yeah?
Walking, swimming, dancing, gardening, it all matters.
Yeah.
Aim for at least 150 minutes of moderate intensity exercise every week,
Okay.
or 75 minutes of vigorous intensity exercise.
So finding ways to move our bodies that fit into our lives,
Exactly.
not necessarily signing up for a gym membership or training for a marathon. I like
Okay.
that.
It's about finding what you like and making it part of your routine.
Oh, and don't forget about managing stress.
Oh, right.
Stress can actually mess with how your body regulates blood sugar.
Makes sense. We often forget about that mind-body connection.
We do.
But how do you actually manage stress? Got any tips?
There are tons of ways to do it, and it's really about finding what works for you.
Okay.
For some people, exercise is a great stress reliever.
Others find peace in things like yoga, meditation, or deep breathing exercises.
Mm-hmm.
Spending time in nature, connecting with friends and family,
Mm-hmm.
or doing hobbies you love can also be really helpful.
It's a good reminder that taking care of our mental and emotional health is just as important as our physical health.
Absolutely.
Yeah.
And they're all connected.
Yeah,
It's a powerful thing.
it is. And it's never too late to start building these healthy habits into your life.
Like-
Whether you're trying to avoid getting diabetes, manage a condition you already have, or just want to feel better overall, taking these steps can make a huge difference.
A huge difference.
Yeah.
So for those who have already been diagnosed with diabetes,
Yeah.
what does effective management look like besides those lifestyle changes?
Good question.
Well, managing diabetes well is a journey,
Okay.
and it's different for everyone, but it always starts with building a good relationship with your healthcare provider.
Mm-hmm.
They'll be the ones to help you figure out a treatment plan that works for you and considers your specific needs and circumstances.
So open communication with your doctor is essential.
For sure. What else is key? Well, regular blood sugar monitoring is really important
Good.
to understand how your body reacts to different foods, activities, and meds.
Makes sense.
Your doctor can help you figure out how often you should be checking your levels. And depending on what type of diabetes you have and your individual needs, medication might also be part of the plan.
Okay, let's talk about medication for a minute.
Yeah.
We know insulin is a must for people with type 1,
Right.
but what about type 2? Is insulin the main treatment there too?
Not always. For type 2 diabetes, medication often involves a mix of different drugs that work in different ways.
Okay.
Some help your body use insulin better,
Right.
while others lower the amount of glucose your liver makes.
Okay.
Insulin might be necessary sometimes,
Okay.
especially if other treatments aren't controlling your blood sugar well enough. But it's not always the first thing doctors try.
Got it. So it sounds like there's some trial and error involved in finding the right combo.
There can be.
But working closely with your doctor probably makes it a lot smoother.
Absolutely.
Yeah.
And it's important to remember that managing diabetes is an ongoing process.
Right. It's not a one-time fix.
Nope. It takes active participation, talking with your healthcare team,
Mm-hmm.
and being willing to adjust your plan as needed.
So it's a commitment to taking care of yourself.
It is. Besides meds and monitoring, what other self-care things are important for people with diabetes?
I'm curious too.
It's all about being proactive and thinking about your health in a holistic way.
Okay.
Remember, diabetes increases your risk of other health issues.
Right.
So you got to address those risks head on,
Mm-hmm.
like pay close attention to your feet to prevent ulcers.
Right.
Those could be a common and serious problem.
Mm-hmm.
Getting regular screenings and treatment for kidney disease is super important too.
Yeah.
Diabetes is one of the main causes of kidney failure.
Wow.
And of course, getting your eyes checked regularly is crucial to catch retinopathy early on,
Yeah.
which can lead to vision loss if you don't treat it.
So it really is about treating the whole person, not just the diabetes.
It really is. It might seem like a lot to manage,
Right?
but I'm sure the peace of mind and better quality of life make it worth it.
Definitely. By being proactive, knowing your stuff, and being involved in your healthcare, people with diabetes can live full and active lives.
That's what it's all about.
Mm.
And that's the message we want to send.
Mm-hmm.
It's not about letting diabetes control you. It's about taking control and living your best life.
Love that. That's a powerful message. It's about empowerment, not being afraid.
Exactly.
We've talked a lot about how serious diabetes is, the problems it can cause,
Mm-hmm.
and how important prevention and management are.
Yeah.
But it's also important to remember there's a whole community out there, researchers, healthcare providers, organizations like the WHO,
Right.
working hard to find solutions and support everyone affected by this condition.
You're absolutely right. And even though there's still a lot to learn about this complex disease, the progress we've made in recent years is pretty amazing. From new treatments to new tech, there's a lot to be hopeful about.
It's inspiring to see the dedication and collaboration happening worldwide. It reminds me that even with tough health challenges, there's always hope. There's always room for innovation, and working together can really make a difference.
I couldn't agree more. And as we keep learning more about diabetes
Yeah.
and developing new strategies for preventing it, treating it, and supporting people,
Right.
the future looks brighter and brighter.
Well, we've covered a ton of information today,
We have.
but I think the biggest takeaway is that knowledge is power.
Absolutely.
Knowing the risks, taking steps to protect ourselves, and getting support when we need it can make all the difference
It can.
in preventing diabetes, managing it well, and living a healthy and fulfilling life.
You've said it perfectly. It really is about empowering ourselves and each other with information. That's how we can make a real difference in the fight against diabetes.
It's been a fascinating and insightful deep dive,
It has.
and I'm definitely feeling more informed and motivated to take charge of my own health.
That's great to hear.
But before we wrap up, I'd love to hear your final thoughts. What's the most important thing you want our listeners to take away from this conversation?
I think the most important message is one of hope and empowerment.
Mm-hmm.
Diabetes is a serious health challenge,
Yeah.
but it doesn't have to run your life. By being aware,
Right.
taking proactive steps, and committing to a healthy lifestyle,
Yeah.
we can prevent it, manage it, and live full lives. And remember, you're not alone in this. There are resources out there to help you every step of the way.
That's a great message. It's about resilience, hope, and taking action. And for those listening who want to learn more about the WHO's global efforts to fight diabetes, you can check out the Global Diabetes Compact webpage. It's mentioned in our source material.
Good idea.
It's a great resource for staying informed and getting involved.
Knowledge is power.
Mm-hmm.
And the more we understand about this complex disease, the better we'll be at preventing it, managing it, and supporting those who are dealing with it.
And on that note of empowerment and action, we'll be wrapping up our deep dive into the world of diabetes. Until next time, stay curious, stay informed, and stay healthy. We've covered a ton in this deep dive. It's a lot to think about.
It is.
But what's sticking with me is that diabetes isn't some far-off threat, you know?
Wow.
It's tied to how we live, work, how the world's changing.
It really is a reflection of our times.
Yeah.
The choices we make as individuals and as a society directly impact our health.
Mm-hmm.
But the good news is
Yeah.
we can change things.
That's what I find so interesting about this whole topic. It's not just biology, it's our behavior, the environment, even our economic systems.
Right.
It's like a wake-up call.
It is a wake-up call.
Yeah.
And thankfully, people are starting to pay attention.
It feels like things are changing.
They are. The growing awareness about diabetes, thanks to things like the WHO's Global Diabetes Compact, it's really encouraging. We're seeing a shift towards prevention, catching it early, and a more well-rounded approach to healthcare.
It feels like we're gaining some momentum.
We are.
And even though we've talked about how serious diabetes is and the problems it can cause, I'm actually feeling pretty optimistic after this deep dive.
That's great.
We have knowledge, we have tools, and there's a whole global community tackling this challenge.
That's the spirit.
Yeah.
It's not about being scared or overwhelmed.
Yeah.
It's about doing something, making good choices, and supporting each other.
Exactly. So for our listeners who are thinking, okay, what can I actually do?
Right.
What's your advice? Where do we even start?
Start small with those everyday choices.
Like what?
Swap that soda for water, take the stairs, park farther away, and walk. Little things like that.
Right.
When you do them consistently,
Yeah.
they add up.
Like we were saying earlier, building that healthy habit portfolio.
Exactly.
And knowledge is a big part of that.
It is. The more we know about diabetes, the better choices
Right.
we can make.
Don't be afraid to ask questions. Do some research. Talk to your doctor. There's so much information out there.
There is. And the more you know, the more in control you'll feel.
And remember, you don't have to go it alone.
You don't. There are support groups, online communities, organizations like the American Diabetes Association and the Juvenile Diabetes Research Foundation.
Right.
Tons of resources and support out there. Reach out, connect with others, share your experiences.
Yeah.
You'll be surprised by how much strength and support you'll find.
It's all about community, right?
It is. Sharing what we know, our experiences, supporting each other, it makes a huge difference.
It does, and every step we take, no matter how small,
Right.
helps create a healthier future for us and for future generations.
It really does.
That's a great thought to end on. It reminds us we're all in this together. This deep dive into diabetes has been really eye-opening, inspiring, and in the end, empowering.
It has.
We've learned about the risks, the challenges, the science,
Right.
but most importantly, we've learned about the power of prevention, how crucial early intervention is,
Absolutely.
and just how resilient we can be.
We've looked at the global picture of this epidemic,
Yeah.
but we've also seen those individual stories of hope and resilience. And that's what I want people to take away from this.
Yeah.
Diabetes is serious, but it doesn't have to be your whole story.
Right.
You can take control, make good choices, and live a good life.
So well said. It's been great diving into this with you. I'm leaving here feeling informed, inspired, and ready to take action.
I'm glad to hear that.
To everyone listening, thanks for joining us on this deep dive into diabetes. Remember, knowledge is power,
It is.
and even small changes can lead to big results. Until next time, stay curious, stay informed, and stay healthy.